For the assessment of physical assessment, first is notes if the patient had any acute distress, difficulty of breathing, pain, anxiety, and if such signs that are present, defer the general survey until later and focus immediately on affected body system. Next is reviews the graphic sheet for previous vital signs and consider the factors or conditions that may alter the values. And then next is determines the patient's primary language and it may need interpreter. And lastly, assess for the history of latex allergy that may include contact dermatitis or systematic reactions. And for the planning, conducts assessment when the patient is amenable and avoid physical assessment that if patient is anxious, tired, hungry. And next is respects the preference for a same-gender caregiver and then encourage the patient to void and then prepare all the materials that all needed: alcohol, tape measure, ball pen, stethoscope, pencil, tip applicator, ruler, kidney basin, cotton, goose pad, and tongue depressor, and then clean gloves. For the implementation, perform hand hygiene and put personal protective equipment because hand hygiene is the most effective way to help prevent the spread of microorganisms and personal protective equipment is required based on transmission precautions. Good afternoon, ma'am. My name is Rhovy Odevilas and I will be your nurse today because this is essential to foster therapeutic nurse relationship based on mutual trust and respect. Ma'am, may I know your name?
My name is Rhovy.
Can you tell me your birthday?
My birthday is on October 24.
This is ensure that I'm in the right patient and receives the right intervention and help prevents errors. Ma'am, I will be doing a physical assessment wherein I'm going to inspect the skin color, your lesions, bruise, or rashes, as well as going to pay attention to abnormal signs and odors of you. And then I'm going to cast directly over your suspected areas of tenderness to check your level of discomfort. Hence, I'm going to palpate by applying varying degrees of pressure on your different parts of your hands to assess for texture, tenderness, temperature, and then your moisture. And I'm going to pulsation and the presence of masses. Lastly, I'm going to listen the sounds of your abdomen by placing my diaphragm of bell of my stethoscope on your bare skin. All you have to do is to follow my instructions. Do you have any question po?
No.
Thank you. And then discussion and explanation encourage you to understand and participate and reduces apprehensions. Now I'll be closing the room door and curtains around your bed to ensure your privacy. For the first physical assessment is general appearance. Ma'am, I want you to do is to walk 5 steps forward. Is that okay, ma'am?
Yes.
Okay, thank you. 1, 2, 3, 4, 5. Then turn around and 5 steps backward. 1, 2, 3, 4, 5. Okay, thank you. Now you may now sit down. Thank you, ma'am. For the general appearance of my client is a well-developed body, built for age, and the head is proportional to the body. And my client's body is within a small frame. Her height is 155 centimeter, and her body mass index is 22.5, means she has a normal weight because her height is, her weight is 54 kilogram. And then she has, as she walks, her posture is erect and is comfortable for age, and her coordinated movement. Her gait is smooth, rhythmic, and coordinated. Overall, she is clean and no body odor that was observed. And she smelled groomed and appropriate for the occasion. As I check for the vital signs, her temperature is 36.5 degrees Celsius. It means she is afebrile. It means that she has a normal body temperature. Also, her pulse rate is 80 beats per minute, which is the pulse rhythm is regular intervals between beats, and her pulsation is equally strong, and her artery feels straight. And then resilient, which means she has a normal pulse rate, and her respiratory rate is 18 breaths per minute, which means her respiratory depth is equal bilateral chest expansions, and her respiratory rhythm is regular rhythm, means evenly spaced, and her character respirations are silent and effortless, which means she has a normal respiratory rate. Aside from that, her heart rate is 68 beats per minute, and it means her pulse rhythm is regular intervals and intervals between minutes, and then her pulsation is equally strong, which means she has a normal resting rate. Lastly, her blood pressure is 110/60 millimeters of mercury, which means she has a normal blood pressure. Now I'll be assessing the mental health status, the skin, and the nails of my client. Ma'am, for the mental health status, I'm going to ask you a questions, and all you have to do is to answer it. Would that be okay?
Yes.
Thank you. First, what time is it?
The time is 6:13 p.m.
Where are we now?
We are in the Taguig Hospital room.
And who are the people with you?
I am with you, nurse.
Okay, thank you very much. For the skin, ma'am, oh wait, I'm going to use alcohol first. Now I'm going to inspect your skin color. Ma'am, please raise your arm forward. Okay, thank you very much. Going to assess your nails. Okay, thank you. The other arm. Okay, thank you very much. Now all you have to do is, I'm going to do like this. Your thumb, please imitate it. I'm going to inspect your nails. Okay, thank you very much, ma'am. For the mental health status of my client, for the findings, my client is conscious and were able to communicate properly, and the client is oriented to the time, place, and person around her, and she is cooperative and pleasant. She uses simple words when communicating. For the skin color of my client is symmetrical, uniform in color, and consistent with genetic background. Her skin is racial tone, which is deep brown. There is absence of edema upon inspection and palpation. The lesions are absent, and there is also moisture. And upon using my dorsal hand, I assess the skin temperature. It is uniform in normal range, and when I pinch, it returns immediately and to its previous shape. And position. It means it is elastic and mobile. Aside from that, the hair is both arms are fine in textures that uniformly distributed. For the nail of my client, the nail plate is convex curvature about 160 degrees, creating diamond shape. As I inspect the nail texture, it is smooth, high vascular, and pink in color. There is no clubbing and deformities. Hence, as I perform the blanch test of my client, it prompt return of usual color within 3 seconds. Now, I'm going to assess the hair of my client. Ma'am, pwede po ba natin tanggalin yung tali ng buhok nyo?
Yes.
Thank you. I will be touching your hair. Would that be okay, ma'am?
Yes. Yes.
Thank you very much. Now I'm assessing the hair of my client. Okay, this part. 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 Okay. Thank you very much. Thank you. And as I inspect, the hair of my client is evenly distributed, and her hair is thick, silky, and resilient. And as I observe, there are no infestation or infections such as lice in the scalp. And as I inspect the amount of body hair, it is evenly distributed and varies on part that I check. Now I'm going to assess the skull and face of my client. Ma'am, okay po ba nahawakan ng inyong ulo?
Yes.
Thank you very much. Do you feel any tenderness, ma'am?
No.
Okay, thank you. Now you may now sit down. Okay. Now I'm going to assess the facial feature of my client. And ma'am, all you have to do is to follow my instruction. Just imitate what I'm going to do with my face. Would that be okay, ma'am?
Yes.
Okay. Ma'am, raise your both eyebrows for me. Okay, then close your eyes tightly. Also, please puff your cheeks. And smile for me. Okay, you may now open your eyes and then frown. Okay, thank you very much, ma'am. Upon inspection, the skull of my client is round, which is nomocephalic and symmetric. It is proportionate to the body size and smooth contour. When I palpate, there is absence of nodules or masses, and it has smooth consistency and no depression and tenderness noted. Also, when I ask my client to move her head by asking to do different facial movements, it is symmetrical and there is no hollowness in the eye area and no edema. Now I'm going to assess the eye structure and visual acuity of my client. I am now inspecting the eyebrows, eyelids, and eyelashes of my client. Ma'am, I will be touching the part of your face. Would that be okay, ma'am?
Yes.
Okay, thank you. Ma'am, kindly straight look ahead lang po. Diretsong tingin po. Okay, thank you very much. Ma'am, rotate niyo po yung mata niyo, taas hanggang baba. Okay, thank you. Now, I'll be touching your inner and outer corner of your eye. feel any tenderness po?
No.
Okay, thank you. Now, ma'am, please face forward po. With the use of my cotton ball, please look straight ahead lang po.
Okay.
On the other side. Okay. Thank you very much. Now, please face forward to me po. Now, I'm going to inspect the pupils for color, shape, and symmetry of the size of my client. With the use of my ball pen, okay. Now, with the use of my gauze pad, I will just place this at the middle of your face. Would that be okay, ma'am?
Yes.
Okay. I will just shine the light on your temporal area of your face. Okay, on the other side. Okay. Now, ma'am, please look only at my ball pen po. I'm now observing the pupil of my client. Look straight ahead, only at my ball pen. Only at my ball pen. Okay, one more time. Okay. Okay, another one. Ma'am, please look straight ahead. Just follow the movement of my ball pen without moving your head. Only your eyes follow the movement of this object. I will move this slowly in different order, forming letter H. Would that be okay, ma'am?
Yes.
Okay, thank you. Okay. I will now assess your peripheral visual field. Now, ma'am, please, urong na po kayo, ma'am. Okay, thank you. Now, ma'am, please cover one of your eye, then look straight ahead. Okay. Please say yes if you see my flicking fingers. Okay, ma'am?
Yes.
Okay.
Yes. Yes. Yes.
Okay, on the other side. Please say yes if you see my flicking fingers again.
Yes. Yes. Yes.
Okay, thank you. Now, I will be asking, ma'am, diretso po. Okay, thank you very much. Ma'am, I will be asking you to read the lines here. Kindly hold this po, yung gauze pad. And then it should be extended until your lap po. Now, can you read this part?
Medical Center Trading Corp.
Okay, another one.
Shaoxing Cooking Health Products.
Okay, thank you very much, ma'am. Upon inspection, the eyebrows, eyelashes, and eyelids of my client, the hair is evenly distributed, intact, the eyebrows are symmetrically aligned, and the eyelashes are curved slightly outward. There is no discharge and discoloration, and as I inspect the bulbar and palpebral conjunctiva, it is transparent. The capillaries sometimes evident, and no sclera appears white. And upon inspection and palpation, the lacrimal gland, sac, and nasolacrimal duct, there is no edema and tenderness. Hence, when I inspect the pupil of my client, it is color black and equal size in shape, which is normally 3 to 7 millimeter in diameter, round and smooth border, and it is flat and round. When I perform the corneal sensitivity reflex test, the client blinks when the client blinks when the direct and consensual reaction to light and accommodation, and then the illuminated pupil constrict, which is a direct response, and non-illuminated pupil constrict, which is consensual response. Also, the pupil constrict when looking of near objects and dilates when looking at a far object. Aside from that, it converges when the near object is moved towards her nose. As I assess the peripheral visual fields, when she looks straight ahead, my client can see objects in the periphery, and aside from that, the 6 ocular movements, both eyes are coordinated, move in unison and parallel alignment. And when I assess the peripheral visual acuity, the client was able to read the gauze pad. Now I'm going to assess the ears and hearing of my client. Now, ma'am, just move your head laterally po. And then I will be touching your ear. Would that be okay, ma'am?
Yes.
Okay, thank you. With the use of my pen light, I will just check your ear. Okay. On the other side naman po. Okay, thank you. Okay, thank you very much. Now I will be doing a whisper test po. I will be 5 steps behind you, and I will say a phrase, and please repeat after me po. Would that be okay?
Yes.
Okay, but wait. Cover one of your ear, your palm. With the use of your palm, cover it, please. Okay, just like this. And now I will be 5 steps behind you. Please, sa likod lang po. Rhovy is nice.
Rhovy is nice.
Other ear naman po. I am beautiful.
I am beautiful.
Okay, thank you. Now for the ears and hearing findings, the auricle of my client is within normal racial tone. Both left and right ear are symmetrical in position with the outer canthus of her eyes. And upon palpation, there is no tenderness. It is elastic and mobile. Aside from that, the pinna recoils when folded. And upon inspecting the ear canal of my client, it has few to none cerumen. The tympanic membrane is color grayish. And when doing the hearing acuity, it responds on the normal voice, and my client was able to respond to whisper test behind of my client with both left and right ear. Now for the nose and sinuses, I will be assessing it. Now, ma'am, I am just inspecting the external nose of my client. Now I am going to assess the patency of both nasal cavities, and I'm going to press my finger to your nose, then exhale. Would that be okay, ma'am?
Yes.
Okay, thank you. Exhale, ma'am. Okay. On the other part. Okay, thank you. Now, ma'am, I will just tilt your head so that I can see your nose clearly. Now, I will be using the pen light and shine the light on each nares. Okay, thank you, ma'am. Now, I'm going to touch your face. Would that be okay po?
Yes.
Okay, thank you. Do you feel any tenderness po?
No.
Okay. On this part, do you feel any tenderness?
No.
Okay, thank you. Now for the noses and sinuses. Nose and sinuses. As I inspect the external nose of my client, it is within normal racial tone. The septum is within the midline, and when I shine the light on her nares of both nostrils, it is pink and both nostrils are patent. Hence, my client is said that there is no tenderness on her maxillary and frontal sinuses. I'm going to assess the mouth and oropharynx of my client. I'm now assessing the lips of my client. Can I hold your lips po?
Yes.
Okay, thank you. Is there any tenderness po?
No.
Okay, thank you po. Now, with the use of tongue depressor, now, can you open your mouth po? Okay, thank you. Ma'am, can you say ah? Okay, thank you. Ah. Ayan. Ah. Oh. Ayan, yan, yan, yan. Thank you. Okay. Thank you very much, ma'am. Now, please open your mouth again po. It's gonna tilt your head po. Now, put your tongue up and down. Left, right, and then stick out your tongue po. Okay, thank you. Hold on po, ma'am. Wait. With the use of gauze pad, stick out your tongue. I will just hold your tongue po. Is that okay po? Okay, thank you. Stick out your tongue po. Ayan. Okay, thank you very much po. I will just hold your tongue and then I'll take it. Okay, thank you very much, ma'am. I will just remove my gloves. Now, for the findings of mouth and oropharynx of my client, upon inspection, the lips of my client are color pink and it is symmetrical on both left and right sides. The mucosa is pink and it is also moist. And the tongue is in the midline. It is smooth and pink in color and able to move her tongue up and down, left and right. Hence, her teeth are complete with 32 pieces. Her gums are color pink. There are no lesions on the gums and the uvula is in the midline. And the tonsils are not inflamed, and the hard palate is rugged and the smooth palate is smooth and pink. Now I'm going to assess the neck of my client. Ma'am, upo lang po kayo na maayos po. Urong po kayo, ma'am. Ma'am, now I'm looking at the neck of my client. It is symmetry on the left and right. Now, can you move your head left? Left po. And right. Okay. Up. And down. Okay, thank you. Now, ma'am, pwede po ba kayo tumingin paharap po? Okay, thank you very much. Now, ma'am, I will be giving force on your head. Please resist it. Okay? Now, move your head to the left side and look on your left side too. Okay, done. On the right side, move your head to the right side and look on your right side too. Okay, thank you. Now, I will put my, and please shrug it. Shrug. Okay, thank you. Another one po. Okay, done. Now, ma'am, I will just touch your neck. I will just tilt your head po. And I just touch your trachea. Okay, thank you very much. Now, please look straight ahead po, and I'm going to palpate your thyroid gland po. Can you, okay. Can you please swallow po? Okay, thank you. Now, I'm going to palpate your head po. Is that okay po ba?
Yes.
Okay, thank you po. Before I start, please tell me if you feel any tenderness po.
Alright.
Okay, thank you. Preauricular, posterior auricular, occipital, cervical, supraclavicular, posterior cervical, tonsillar, mandibular, and then submentum. Is there any tenderness po ba?
No.
Okay, thank you very much po. Now, as I inspect the neck of my client, it is equal in size, both have equal muscle strength, and lymph nodes are not palpable, and the client reported that there are no tenderness, her trachea is in the midline, and the thyroid gland is not palpable. However, it is palpable when my client swallow. Now, I'm going to assess the thorax and lungs of my client. Ma'am, please raise your arm po. I will just measure your anterior and posterior of your barrel chest. Okay, 37 centimeter. And then sternal line to mid-axillary line. It is 20 centimeter. Thank you. Okay, ma'am, please stand up in lateral position. I will just touch your back. Okay, thank you. You may now sit down. Ma'am, I just want to ask you if when you're breathing, may masakit po ba? Or may naipit po ba sa inyong chest?
Wala po.
Okay, if wala, I'm just going to put my hand in your chest if there is bulge. Would that be okay?
Yes.
Okay, thank you. Can I touch move your hair po? Okay, thank you very much. Okay, thank you. Now, ma'am, talikod po kayo sa akin. Okay. Now, take a deep breath, then exhale. Okay, one more time. Take a deep breath, then exhale. Okay. Thank you. Now, can you say the word blue moon?
Blue moon.
Another.
Blue moon.
Another.
Blue moon.
Last one.
Blue moon.
Okay, thank you. Now, I'm going to percuss the thorax. Okay. Now, ma'am, take a deep breath. Wait, hold on. It's gonna take my pencil now. Take a deep breath. Inhale, then hold it. I will just percuss the left, then mark it with a pencil. Now, take a deep breath again. Then exhale, but hold it please, ma'am. I will just percuss, then mark it with a pencil. Okay, thank you. Okay, 4 centimeter. Okay, ma'am, another. You repeat it for the left side. Please take a deep breath. Inhale, then hold it. I'm just gonna mark it. Then again, take a deep breath. Again, then exhale, but hold it please. Now I will just measure it. Okay. 4 centimeter. Now, thank you very much. Just use the stethoscope, but clean it first, the earpieces and the diaphragm. Okay, on your back, inhale, exhale. 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 Okay, thank you, ma'am. Now, on your front, harap po kayo, ma'am. Okay, thank you po. All you have to do is to follow my instruction po. Inhale, exhale. Okay. Inhale, exhale. Okay. Inhale, exhale. Okay. Now, I'm just gonna put this on your shirt. Inhale, exhale. Okay, thank you. Ma'am, can I put the diaphragm on your inside of your shirt? Okay, thank you very much. Now, inhale, exhale. Okay, thank you very much, ma'am. But I will just clean it first. Okay, ma'am, thank you very much for your cooperation. Now, for the findings of thorax and lungs upon inspection, the shape of the thorax has 1:2 ratios in anterior, posterior to lateral diameter, and the chest is symmetrical size. Upon inspecting the spinal alignment of my client, it is vertically aligned from cervical, thoracic, and lumbar. And then upon palpation of the thorax of my client, there are no bulges, no tenderness reported, and the chest wall is intact. And for the respiratory excursion, it is full and symmetric, both left and right. The chest expands about 3 to 5 centimeter when the client inhales deeply. Hence, the fremitus, as I palpate, the tactile fremitus is symmetrical on both left and write the vibrations of the vibration that I felt is a high bit higher since my client is female, and when I percuss, the sound that I heard is resonant throughout throughout. Upon doing the diaphragmatic excursion, the diaphragm excursion is 3 to 5 centimeter both left and right, and when I auscultate the chest, I heard the middle part vesicular, the lower or base of the lungs is bronchovesicular, and on the upper portion, I heard it is bronchotubular, and there is no adventitious breath sound heard over the chest of my client. And for the evaluation of the physical assessment, documents any findings in the client's record using the printed or electronic forms or checklists that supplement the narrative notes when appropriate, and perform a detailed follow-up examination of other systems based on findings that deviated from expected or normal for that client, and relates the findings to previous assessment data if available.